Hi, I'm John Phillips. I'm a second year in the program, and right now we are hanging out in room 231. It's one of the two main classrooms that we use for the program. And we take a multitude of classes here, including geriatrics, advanced neuro, cardiopulmonary, kinesiology. Probably one of my favorite classes is advanced neuro. It has both a didactic portion and a laboratory, like a skills portion. Some of the things we do in the class include treating patients here and also going to one of the hospitals, Orlando Health, to go treat patients there as well and receive some lectures from some of those clinicians.
Hi there, I'm Jeff Schmidt. I'm a second year here in the physical therapy program. I'm also in room 231, where John had mentioned that we have a lot of our lecture courses. We also have a lot of lab courses here. We use these tables quite a lot in classes including cardiopulmonary, neurologic PT, and geriatrics. We have numerous resources here in this classroom, including this ventilator and suctioning materials that you might use in the intensive care unit. What's interesting about our courses is that they're taught by specialists in these specific areas. Our cardiopulmonary class is taught by a professor that has been working in the ICU for tens of years now.
Good morning, my name is Gabriella Armour and I'm a first year student here in the DPT program at UCF. We are in room 250 where we have our bigger classes that require hands-on labs. As you can see, Jeff and John are in the background doing some joint mobilizations for the hips. We have adjunct professors join us for our lectures and labs to give their input for more class participation.
Good morning, my name is James Maggart and I am a current second year here at UCF. We're still here in room 250 doing some more lab activities. One of the main things that we hear a lot here at UCF when we go out into the clinic is that UCF produces some of the most prepared students during their first clinical, and a big part of that is our integrations class. This is a class that happens near the end of the first year, and we get to put together all of our didactic knowledge and lectures into one big patient care scenario. We transform the whole classroom into whatever setting we might be practicing in, as you can see. And we take the time to take everything we've learned in the program thus far and put it together and use it on simulated patients, which are actually our classmates.
Hello, my name is Kyle Abad. I'm a first year in the DPT program and we are in our PT anatomy lab. So in our first year, one of our core classes is anatomy, neuroanatomy 1 and 2. The way that class looks like is we would come in on Wednesdays and talk about a certain structure of the body, for example, the upper extremity. We would go into detail talking about the bones, the ligaments, the muscles that attach to the bones, as well as the neurovasculature. On Thursdays, on the very next day, we would come into this anatomy lab and dissect those very structures in person to make it a more hands-on experience. So recently, we've had renovations done to the anatomy lab that included the installation of these surgical lights, ventilation tables that take the fumes from the cadavers into the table and out of the building, as well as installation of these special cameras that we can use to broadcast images on a certain cadaver for the entire room to see, so we could display them on the monitors that you see. One of the special things about our program is that the cadavers are PT exclusive, where we don't share the cadavers with the College of Medicine or the nursing program, and we also have 24/7 hour access to the building. So you could come in after hours, study cadavers, or even use the other rooms that you saw, like 250 and 231, as study spaces to practice with your classmates.
Hi, my name is Akash Bali. I'm a second year in the UCF DPT program. I'm here to talk about our experience with the UCF Med School at Lake Nona. So recently we got the privilege of working with the medical school as teaching assistants. Why we do that is because we actually get 2 times more anatomy experience than the med students do. And what happened was we get selected, go to the med school and help teach the anatomy lab. This is a very good interprofessional education event just because they get to see what we do and as well as us experiencing how they look at things from a different lens compared to us. It was a very good experience just because we got to learn various surgical techniques and radiological techniques that they do versus how we look at things from a more musculoskeletal perspective.
So our program offers a few off-campus labs for our use. One lab, the Innovative Mobility Initiative Lab, is run by Dr. Dawson and Dr. Tucker. There are a few projects that are run out of there, including the Go Baby Go and Grow and Play programs. Dr. Stock also runs another lab called the Applied Neuroplasticity Lab, which has numerous resources at hand for us to use, including strength and conditioning equipment, VO2 max with cycle ergometer, transcranial magnetic stimulation, isokinetic dynamometer, as well as ultrasound and EMG sensors.
Actually decent.
I was surprised
I was surprised you
wording
nailed
of
that
that.
on the second try.